This topic is complications of the placenta. Let's take a moment and remember the functions of the placenta. Think serpent: storage, endocrine, respiration, protection, excretion, nutrition, and transport. Please watch the placenta video in the maternal and newborn course for a thorough discussion of the placenta. In this video, we are going to discuss some complications. You can see a normal placenta in this image. This will be important to remember as we look at the different complications of the placenta. Subchorionic hemorrhage, in which there is bleeding or a collection of blood between the uterus wall and the chorion or sac that surrounds the embryo in the uterus. Then there's placenta previa, vasa previa, and abruptio placentae. We'll talk more about these three in this video. For more information on placenta accreta spectrum and retained placenta, I encourage you to watch the Complications During the Third and Fourth Stages of Labor video in the maternal and newborn course. Placenta previa. This is from abnormal implantation of the placenta in the lower uterine segment, resulting in partial or complete covering of the cervical os. Clinical manifestations. The client may be asymptomatic and it may be an incidental ultrasound finding. Or the client could be symptomatic with painless vaginal bleeding of bright red blood after 20 weeks gestation, and uterine irritability may be present. Risk factors include uterine scarring from prior uterine surgery, like a cesarean birth, or uterine myomectomy, in which fibroids are surgically removed from the uterus. Prior placenta previa, advanced maternal age of older than 35 years, tobacco use, multifetal gestation because there is increased placental surface area resulting in increased risk for abnormal implantation. Complications include maternal hemorrhage. In this series of images, you can see the different types of placenta previa, starting with normal placental placement and going all the way to complete placenta previa. Underneath the images, you will see the expected outcomes and management for each type. Management for placenta previa. If a pregnant client is having any bleeding and the placenta location is not known, a digital cervical exam is contraindicated because the finger entering into the cervical canal could damage the placenta and cause bleeding. You can see this on the image on the left. An examination using a speculum, as seen in the image on the right, will be performed for clients with placenta previa. This can be used to observe and assess vaginal bleeding. Notice the speculum is not entering the cervical canal. Management: pelvic rest, and that includes no intercourse. Inpatient admission for bleeding episodes. We will perform pad counts to determine the amount of bleeding. Has there been an increase? Any change should be reported to the healthcare provider. Ensure a type-in screen has been performed and that the client has patent IV access in case a blood transfusion is needed. RhoGAM will be administered for RhoGAM-negative blood type after bleeding episodes. Monitor fetal well-being by assessing the fetal heart rate. This client will have routine ultrasounds for monitoring. If this resolves, now remember from the images earlier, for some types of placenta previa with only partial covering of the cervical os, it may resolve, making vaginal delivery an option. If unresolved, a cesarean birth prior to labor will be performed, normally around 36 to 37 weeks gestation. This avoids potentially life-threatening bleeding during labor. An emergency cesarean birth will be performed if maternal hemorrhage is present, and if the bleeding cannot be stopped, a hysterectomy may be necessary. Vasa previa. The client will present with painless vaginal bleeding due to fetal vessels traversing or passing over the cervical os. You can see this in the image. If bleeding happens, the blood loss is fetal, and it manifests with rapid fetal decline because the fetus is no longer receiving oxygenated blood. This has a high mortality rate. Digital cervical examination is contraindicated due to the risk for rupturing the vessels. Abruptio placentae, premature separation of the placenta from the uterine wall prior to birth. This will stop the fetus's supply of blood carrying oxygen and nutrients. You can see in the image where bleeding occurs between the lining of the uterus and the placenta. That collection of blood starts to push the placenta more and more off of the uterine wall. Risk factors include preeclampsia, uterine tachysystole. Remember, that is more than 5 contractions in 10 minutes. Potent vasoconstrictors like cocaine or tobacco use because of their effect on the mother's vessels where the placenta is attached to the uterine wall. Manifestations: sudden onset of bleeding with dark red vaginal blood. Or the bleeding may be concealed. Remember that image from the last slide. An acute increase in intrauterine pressure and elevated resting tone, causing severe abdominal pain, uterine irritability, and a tender, firm uterus. You will see fetal heart rate abnormalities with recurrent late decelerations. The client may also experience a decrease in fetal movement. Complications: impaired fetal oxygenation resulting in a stillbirth. And maternal complications include hemorrhage leading to hypovolemic shock and possibly death.